herb.
Hey guys, good morning. We are here. Third time is the charm with
Yeah, right.
Doula Jocelyn. Thank you so much for
Thank you for
joining
having
us this morning, all the way from Phoenix, Arizona.
us.
That's like
Yes, it
working on its own time
is
zone.
rising behind me at this point.
Like, but you told me that Phoenix has its own time zone. Now, how
It
did that happen?
so Arizona does not follow daylight savings time. So when everybody else is doing their thing, switching their clocks, we're just sitting here like, why do people do that? That's strange.
So, what time is it right now?
Right now, it is 6:41 in the morning.
Listen, thank you for being here. We had a ton of technical difficulties, you guys, but thank you for being patient and joining us. We can't wait to just get the feedback, especially from the people who like watch the replay and who are like,
Yeah,
digesting it. So,
everyone on this side of the country is going to be watching that replay because everybody's asleep right now.
like everybody's asleep right now, and it's going to be so hot today. But I think this is a hot conversation, a very, very hot topic.
Very true.
Cannabis and pregnancy. Um, and let's just jump right in. I want to first ask, what is a doula?
Okay.
Because I didn't really know. And then how did you get started? So,
Okay. So a doula is a birth companion. Well, technically, okay, I'll step back from that. There are many types of doulas in the world. There are birth and pregnancy and postpartum doulas. There are death doulas that are becoming very popular, and you can Google them, and there's these really cool videos about the work that they do. Um, there are life crisis doulas, and really we're just support people. We're peer support individuals who provide services to people from all walks of life. Anybody that we feel a connection with, um, we embark on a journey together, and we really just support you mentally, physically, emotionally, and we're really just a guide on whatever journey that you're taking.
So it seems like a more or a deeper connection than say just an obstetrician. Just I guess unless you've had your obstetrician for a really long time and your obstetrician also is your births babies, because it doesn't all work the same, right? Am
Right.
I right there? Okay. So
Right.
how did you get started in this field?
So I've always been a person of service. I've always wanted to support people and and normalize the situations that they're going through because nobody's going through something alone. We all have ties that bind us together, and when we find those, it can support us in an emotional and psychological way and get us through really troublesome times. One of those being, birth in America. This is a really difficult place to birth in, especially when you're Black and brown. It's a very dangerous place to birth in. We have really horrible statistics that I won't really get into because they kind of drag the conversation down. And we're really on a high point right now. So, but there's a lot of information out there that really can put you in a negative spot when you're about to give birth. And for me, when I became a mom, the only person that was there for me in that moment of transition, for me becoming, going from me to becoming a mom, was my doula and my partner, my husband, who's sleeping right now. Uh, and it took a lot of processing of my birth trauma that surrounded that experience to realize that the doula really held everything together for me. And I didn't even intend on having a doula there. My midwife suggested that I have a doula there,
So
and it went from a home birth plan to a transfer to a hospital to an emergency C-section, and in all of that, the only force that was there holding space for me was the doula.
So you had an obstetrician.
I had a certified nurse midwife.
Okay, so the midwife replaces the obstetrician?
The obstetrician, because obstetrics is a medicalized birth situation. They treat it as a medical condition. Midwives treat it as a natural physiological event.
Oh,
Yeah.
okay. Okay. So you had a midwife and you had a doula.
Yes.
How did you come to the decision that you wanted a doula?
This was 6 years ago. Um, at the time, there was no discussion of medical marijuana in Arizona. There was no discussion of alternative medicating for pregnant women, and really, there's still no discussion on that. We don't really have many rights when we're pregnant; those are separated and removed from us. Um, so I knew that going the full medical route was not going to be for me because, A, they have mandatory drug testing of pregnant women in Arizona. Um, if they suspect anything, they will automatically drug test you. That was enough for me to say, you know what, I don't want to go down this route because it's just there's too many pitfalls and there's too many bear traps for me. So we went the midwife route fairly early on. I think I was about 4 months pregnant when we decided to do a midwife.
So, in a sense, the midwife was really to kind of legally protect you because of this drug testing that could take place that could then have really, really horrible repercussions.
Right. And when you look at it that way, there really was no safe way for me to give birth. It was just the safest way to give birth because if I went down the full medical route, I mean, most hospitals in Arizona have a 36% C-section rate. So I'm already down that path and probably going to have that result anyway. If I go with a medical route, I'm probably going to get drug tested and I'm going to have to deal with that. If I remove myself from the medical side, some people say, oh, that's risky. And I'm like, I'm already facing risks. So what those risks worked for me a lot better. Mm-hmm. And I loved those risks because I chose those risks. Those risks weren't put on me. So I loved the idea of kind of navigating away from the medicalized birth aspect, especially 6 years ago when there were no cards, there were no dispensaries, there were no nothing. It was the Wild West, you know?
Right. I just want to say thank you to everyone just joining us. Vanessa Jackson, thank you for tuning in. We're so excited. Please share this broadcast and comment and question. We are here today with doula Jocelyn out in Phoenix, Arizona. It is early. Listen, Vanessa Jackson, because I want you to just talk about now, 6 years ahead, where is Phoenix with the laws? Vanessa Jackson writes, in California with Kaiser, I was drug tested every time, even though I was open about my medical cannabis use. They made me see a social worker every time, and we constantly fought back and forth about how my medical cannabis use was not drug use. I wish I had a doula then. All unnecessary stress I knew I was going into every time. Wow.
Yeah.
Wow. Yeah. Well, okay, so before you tell us what the Vanessa, thank you so much for sharing that. Thank you. Before you tell us what the laws are currently in Phoenix, I just want to make sure that I'm understanding in case anyone else has questions. So in a case like Vanessa, not like Vanessa's, but like yours, you had a doula and you gave birth at home, right?
I did not give birth at
home.
Okay. Laboring at home because this is why I became CannaDoula.
Okay.
It all ties into this first birth, and it took so long to put it all together and make sense of everything. I finally made it make sense, right? So I went the midwife route, but unfortunately, midwives are mandated reporters. So if they feel that cannabis use is inappropriate for pregnant people, they will also report you to CPS or DHS or whatever.
That's what I wanted to get at. Like how so
6
okay.
years ago, even though I was going that route, I still had to keep it a secret. There was still nobody that I could talk to and open up with and discuss who would understand what I was speaking about. But I felt safer going that route because she was a naturopath, because she used essential oils, because she understood misinformation. If we did have to go down that route, I felt more comfortable going down it with a certified midwife who was a naturopath and who subscribed to some of the ideology surrounding natural alternative medicine. So there was still that sense of like, I can't tell anybody about this. Like, this is a part of my pregnancy that I'm never going to share with anybody.
Mm-hmm.
And that's isolating. It totally affects things. So when I went into labor with my son 6 years ago, I had all that fear retention in the back of my mind. It stalled my labor because then I'm like, hour 4, hour 5, and hour 4, hour 5, and you're in pain, and your go-to for pain is cannabis, and you can't utilize it because you've got an audience of people who don't understand and aren't in on it. It stalled that labor, and I went 14 hours labor with my son, and it all ended in a C-section that took 15 minutes.
Wow. So you were using cannabis to manage the pain.
I was using cannabis because I have rheumatoid arthritis. I was a dancer for a very long time. So when I gained a lot of weight, everything swelled and inflamed, and I was just in pain all of the time. So that was my morning, get ready for work. Okay, I got to take my meds too, and then I can get going. I was working with babies, picking them up, changing diapers, doing all this stuff, and I was waddling around pregnant too. So that was just my go-to, was a nice CBD before, and then a THC at night to make me go to sleep. And then that was all I needed to go.
Okay.
But that was the situation, but it was completely illegal and secret. And
yes.
it brought up a lot of fear, and it did stall that labor, and it was a completely different experience for my daughter 3 years later. Completely different.
And was that because the laws had changed, things had changed, so you
I
felt
left Arizona.
okay, now go ahead. Now, okay, so you left Arizona, and obviously
Yeah,
you come
Portland,
back.
Oregon.
Oh, you went to Oregon. Okay. And
Yeah.
what happened during that transition? Excuse me, guys. I'm going to open my window. It's so hot in here. I know I'm glistening.
No.
99 in New York today, y'all. But go ahead. Tell us. I want to get to the heart of the transition and the journey, the actual journey, the nitty gritty of the work that you had to do and when cannabis got infused. So you go ahead.
So we left Arizona about 6 months after I gave birth. We went up to Portland, Oregon, and I was like, what am I going to do here? What brought me here? There was a little bit of work that brought us here. There was a little bit of family and friends that brought us here, but I got to make my time worth it here. So I started looking around. I was like, I could go to naturopath college. It's down there, downtown Portland. I could do this, I could do that. But that doula kept coming back into my mind. And I was like, I don't know how she did that. I don't know how she saved space for me. Like, how did she do that? And I talked to her, and she talked to me about doula training, and I started looking it up. And I didn't even realize that Portland is like birth mecca
Hmm.
for the states. Like, if you want to learn about natural childbirth, that's a good place to go.
Okay.
Have a midwifery model of care in most of their hospitals. So while they do have OBs, they do not run the show. The midwives run the show. The midwives do did most of my appointments with my daughter's pregnancy, and it was fantastic. We had 30-minute conversations with each other, which was a lot better than an OB where you get about 10, 15 minutes to ask your deep questions and get a really quick response.
Mm-hmm.
The assumption was I was going to have a vaginal birth after cesarean, which is, in many hospitals, it's against policy to even suggest that. So everything was different when I moved to Portland. And
Hmm.
I knew that the training was going to be there. So I started looking into colleges for midwifery, and I found Birthing Way College of Midwifery. I also found Shafia Monroe, who is, she does full circle doula training, which is what Erica Badu went through.
Okay.
That's how she became a doula. They're very close. Um, so I worked in tandem with these two doula training companies to kind of figure out how to best serve my community, but with the best information possible. And these were the two main training facilities that I worked with. I did my training in 2013. I started taking clients, and it helped me process a lot of my birth trauma
Mm.
because, again, it was that idea of we have common threads. This is not just happening to me. That didn't just happen to me. That's a thing that happens regularly. And the only saving force for me, anyway, was that doula barrier to say, I'm here for you. I work for you. I'm here to provide service to you and your needs. I'm not leaving you. I'm here with you. I'm here with them. I'm here working with everybody in tandem to make sure that you have the best and most affirming experience possible.
Now, how open were you about your use during that pregnancy with your doula, and how does that how does that conversation happen? Because I'm thinking about, and y'all tell us in the comments with a heart and a like now I'm a lot more comfortable than past
Right.
years to go to my doctor and they hit you with the do you smoke, and I go yeah, and they look at you and I go, and they go what do
See,
you
here
smoke,
you
and I
go.
go it's weed, and they're like
You go,
oh okay.
do you smoke? Smoke what? That's still the answer here.
Yeah,
Smoke what? And then they know automatically, oh, okay.
yeah. It's not because it's talking about so oh I smoke cigarettes. Well, you need to stop smoking. If you stop smoking today, and they go through the whole thing, 10
Right.
years back. But when you say you're smoking weed, they're all like, oh, okay, all right.
Okay. I don't really know much about that, so all
But
right.
however, there is a divide with some doctors, not all, but some
Mm,
some doctors. There was a study that came out according to the Society of Obstetricians and Gynecologists of Canada, and shout out to Canada for going fully legal this year. I'm on my way. But it did say marijuana use can lead to preterm birth and low birth weight, as well as lower IQ and hyperactivity after a child is born. On the flip side, so one, there's that divide between medical professionals there, but there is
right.
this flip side where women who are actually pregnant and who are actually going through this or have went through this are like, well, that wasn't the case for me. It helped me to manage the pain. It helped me with the nausea. So is there anything else that cannabis does help with that the doctors are just not seeing or choosing to ignore? Do you have any theories on that? And also, are we referring to THC or C versus CBD? Is it both, or what do you have to say?
Okay, so the first thing I want to say is most of our doctors are not trained in endocannabinoid systems. So they won't have any working knowledge of how those systems work. That's the major downfall, is that when you're asking them about how cannabis works, they don't know.
Mm-hmm.
And that's what I said before, is that some of these questions nobody has the answer to, because we've been bogged down and told not to ask it so much that we don't have the answer yet.
Right.
So a lot of our OBs, a lot of our nurse midwives who work in hospitals, a lot of our nursing staff, they just don't know. And what they don't know, they say to abstain from. So if you don't know, stay away from it. It's dangerous. And so that's really where it comes from the medical side. They I don't blame them. I feel bad, because it's knowledge that they don't have and that they're being barred from. There is a lot of discussion about low birth weight and behavioral problems. My theory on that is that it's racialized. I think that a lot of it comes down to poor working class individuals are usually the ones who will opt for cannabis use.
Mm-hmm.
It's natural, it's more affordable, it's accessible now in more areas than ever before, and it's a way to take back ownership of our medical needs, to self-medicate in that way, under supervision, of course, optimally.
Right.
But I do feel that there is a level of racialized stigma there when they're saying that there's behavioral problems, that there's low birth weight. Low birth weight can be a lot of things. Low birth weight can be cigarettes. Low birth weight can be pollution. Low birth weight can be malnutrition, which is a huge problem. Most pregnant women are not eating what they need to eat. They're working long hours. They're not getting enough rest. They're not building enough muscle. And those are deficiencies. Those are not cannabis related necessarily. Those are social issues that we need to address,
right.
not substance issues.
And you've had your 2 children, right?
Yeah.
How are your kids today? You know what I mean?
I'm part of the anecdotal evidence that says, what are you guys talking about? My kids are fine. They're 6 and 3, and they're 6 and 3.
Mm-hmm.
I don't look at them and see behavioral problems. I see a 6-year-old and a 3-year-old.
Mm-hmm. Mm-hmm.
I see a 6-year-old and a 3-year-old that's raised in their culture. So while their behavior may be to the outsider something that's problematic, I don't see it that way, and my people don't see it that way. So I don't see what the problem is.
Absolutely.
If they're saying that he or she, because I have a son and a daughter, if they have behavioral issues, I'm asking why. I'm not trying to figure out what to blame or who to blame for the behavior, because that's their behavior. That's them. That's them being a human being. You know, my son was really frustrated at school one day, and he got written up for being really frustrated and lashing out. And I never got an answer as to why he was frustrated. I just got the behavior report. And I'm like, I don't know why he's mad though. Like, nobody asked him. Just his behavior problems out of nowhere. I'm like, well, society. I mean, you know, he got frustrated.
And, you know, I think that, you know, it's about getting to the root of what some of these issues are. And yeah, you know, maybe just asking the child, you know, why are you frustrated? Like, you know, you might have to go, let's just explore that. And I also, you know, I find it really, really interesting with regards to cannabis use and pregnancy, is that it's not that it, oh, Lord, there's an echo. But it was used before. You know, there's
like 2,000 years of history with cannabis use, and it wasn't just men using it.
So how do we choose to ignore, you know, these things? But I would like to just go back a little bit and just to talk about, are you using THC, CBD, both? And does one offer, if you are using both, does one offer something that the other one doesn't? Could you get into that a little bit?
So, I mean, something is better than nothing, is how I feel about it. If you can only get CBD, first of all, there's active THC in it. It's just a low quantity that is hardly traceable, but you're still getting it. Anything's better than nothing. If CBD is all you can get, use it, utilize it. I believe that full spectrum cannabis is the sweet spot. That trying to separate things and trying to manage it, and it will lead to mismanagement eventually. You might get the wrong dosage, you might get the wrong strain, and it just doesn't work with you. When you have that full spectrum, your bases are covered. As it pertains to pregnancy, the main question with THC seems to be the psychoactive components to it. How does it affect brain development? I usually counter that with, what does poverty do to the developing brain?
Mm.
What does violence do to the developing brain? What does stress do to the developing brain? These are also factors that have very real consequences. But for some reason, we're just focused on, what does cannabis do to the developing brain? What does a lack of cannabis do to the developing endocannabinoid system?
What does it do for
What happens when you're developing an endocannabinoid system and you don't have any um, supplemental cannabis in your system? You're not getting it from foods because you're malnourished. So, you're not eating mangoes. You're not eating the good stuff that has endocannabinoids in them, or cannabinoids in them. You're not getting it from any kind of supplement like medical marijuana or cannabis-infused products. So what does that do to your developing brain? We know that it's a part of us. We know that we have our own endocannabinoid systems, and they're deficient right now, right?
Yep.
So what does that do to the developing brain? Nobody ever asks that question.
Mm-hmm.
So I think that question is just kind of like, well, it's kind of a mirror. It's trying to reflect something back and keep you away from asking those real questions.
Right.
I don't really think there's any proof that there's problems with THC and the developing brain. I think it's just a guess right now.
And guess probably rooted in a lot of fear of the unknown, even though there's a lot that we do know about the plant. 2,000 years, there is history there.
An epidemic by now.
Yeah.
You'd see it by now. There are cultures that utilize cannabis in every way that it can be utilized, and there's no pocketed, situation there. There's no epidemic there. So what are you talking about? Where is it coming from?
Yeah.
Is it stigma that's rooted in other places? And I believe that it is.
Absolutely. Especially when you have neurosurgeons and, Dr. Sanjay Gupta coming back and saying, you know what, I was wrong. If we were discovering this now, this would be a superfood. And it's like, great.
And when they come out and they say I was wrong, they knew they were wrong 15 years ago.
Oh, well, there's that.
They might have something in their pocket that was also green.
Mm-hmm. Yeah.
That was keeping them from saying what they knew to be true.
Right. So
there's a lot of lobbying going on.
There is. Now, before we get into that, because I do want you to touch on, if there are issues that you face, doing this work, as opposed to big pharma wanting to come in and go, no, use this for your pain management and use this for your nausea. Could you tell us about the process? So if I wanted to use your services, I'm pregnant, and I consume, obviously, what is that? What do my 9 months look like?
So, okay, I'll answer it in two different ways. So if you are embarking on this journey, it's your first pregnancy, you may have been planning or not planning to become pregnant, but here you are.
Yeah.
You utilize cannabis and you're like, do I have to stop? Like, what's going on? Like, am I still me? That's where this question is rooted from, is, am I still me? Can I do what I need to do?
Yeah.
And if you don't have anybody that supports you in your decision to continue to consume cannabis, you have a 9-month stint in isolation.
Mm.
Eventually, the friends that you partake with will probably find it awkward to hang out with you because you'll be extremely pregnant. That totally happened to me. And I understood. I still had some amazing friends that would come over and bounce with me on my birth ball and, pass me a joint or something. I'd take a few puffs and then we just talk about pregnancy and how things were going. And they normalized it for me. But for the most part, I just didn't, you don't have anybody to really discuss that part of your pregnancy. You're going to have it's such an expansive, yes, that is true. It's such an expansive journey that cannabis is only really one part of it, but it's just one part that you really want to share with everybody. And sometimes that can be isolating. If you use my services, most people contact me around, they're getting really early with it, which is really good. Probably around 3 to 4 months is where you want to contact me.
Okay.
We'll do a consultation. We'll get to know each other. We'll sign the paperwork and get services started. And then you basically have access to me. You can call me, text me, email me. We can video chat. We can meet up for coffee. We can do play dates if you're local. Just having that friend and companion is the whole point. When we get to labor and delivery, then you have a support person with you the entire time. I don't go home unless you say, go home, get some rest. I got this for a little bit, which a lot of moms do.
Okay.
They call me early. We do a little bit of early work. And then she's like, I think I got this. You can go home and rest. And I'll call you when things are really kicking up. And usually I walk in and I can hear my client from the elevator down the hall. I can hear her and I'm like, oh, yep, here we go. Then I walk in, I set up my stuff, I get my bag all unpacked, and usually an hour later there's a baby, and it's amazing.
Wow.
It's such rewarding work that all of the risks that come along with it, me talking about weed and talking about pregnant people smoking weed. And, most of the time I'm saying you could probably just stop smoking and start eating it and you would be good.
Real? Okay. And are there different benefits? Why is that?
So for me, when I got into my second trimester, that's when the baby started to get really heavy on me in my womb. And it started to weigh heavily on my bladder. So anytime I would inhale and cough, with permanent discomfort, possible incontinence, it was bad.
Okay.
So then I started eating it. I started using butters, on my toast in the morning. And I had a time released situation that would happen. Instead of me feeling it and then it going away in about 30 minutes, 45 minutes, it was lasting me 2 hours. And I didn't have to cough. I didn't have to put any of the, inhalants in my body. And we were good. We were still balanced together. And that was really what I was trying to do, is balance me and baby out, because it was this whole new thing in my body and it's causing imbalances. And I was just like, no, we're going to ride this wave together as best we can. Yeah.
And what are the costs for these services?
So I have a set cost. It's $1,000 for the entire package. That is split into 3 payment plan options if you need it. And I also offer a hardship discount on top of that. That's why I'm saying a lot of my clients are getting in early, and I love it because people don't budget for birth. And they need to, because it's expensive. I have an itemized list of services from a local, I won't show the name, but I have a local birth center.
Mm-hmm.
Let's see. I mean, when I got my midwife, that was $5,000 for my son's midwifery services.
Oh.
That's much cheaper. That's half the price of a hospital birth, but your insurance is paying for it if you have insurance.
So does insurance cover the cost of doulas currently?
No.
Interesting. Okay.
You might have insurance that covers their doulas, but there's no insurance that covers the cost of a private doula. Now, when I was in Oregon, there's the Oregon Doula Association, and they were pushing to have something on the books that would cover private doulas. I don't think they ever got it through, and that's the kind of stuff that you have to navigate when you're becoming a doula, when you're deciding if you want to certify. Some hospitals only take certain doula certifications for their programs that are covered by insurance. And so you would have to make that decision for yourself, becoming a doula, if you want to certify and go through insurance and maybe get $200 for your services, $500.
What was the cost for you to become a doula?
Training alone was $3,000. But I've done a lot of free work. So I don't even measure how much I've spent doing doula work.
And are there a lot of
doulas? It really is a work of love. It's a passion, yeah.
And doulas of color are what is that face, Jocelyn? Thank you, Angela. Thank you guys for the comments. Please, keep them up.
We're broke.
Are we lacking in doulas of color? Do we need more? What is the state? Because, honestly, before Erykah Badu, I don't even know.
I didn't really know what a doula was before Erykah Badu came out. Yeah.
Yeah.
We definitely need more doulas of color. The more the merrier, and there is no competition. That is the biggest thing too, is there is no competition. Don't think that there isn't enough for clientele for everybody. The issue we face as doulas of color is we are in the minority. The people who do have the money for our services are not people of color. And that was something that I had to take an introspective look with after I had a certain client that treated me very much like staff. Like I was there to provide cleaning up services, rub feet and rub your back and make no attempt to become part of this birth team. I was staff. And putting myself in that position, I really had to think, who am I going to serve? And will they take my services respectfully? That's when I really started working with people within my own community a lot more. I think that's something that doulas of color and birth workers of color really need to think about is, who are you going to serve and how are your services going to be accepted? Are they going to be respected, or are you going to be disrespected, ask for discounts because they think you're cheap, overutilize you to the point where you're, a labor mule and you can't support them because you're being stretched too thin. They have to respect your boundaries, and you have to find your boundaries too. So for doulas of color, yes, we need your services, but be prepared to acknowledge that the people that are going to utilize it and pay you, pick those people wisely. Pick those people wisely. Definitely do the work though, because we're going into these situations, all white hospitals, all white staff. And we might be the only Black person in the room, and we know that experience all too well. And being in that experience in the very exposed state that is labor and delivery is very difficult.
Gosh, I've gotten so much information.
I do that a lot. A lot of people are like, whoa, that's a lot. I got to decompress.
Where do you see yourself and your business? We're at such a new age with cannabis and legalization. Equity programs are coming into play. Shout out to Massachusetts for their equity work. Shailene doing amazing work out there in Oakland, the Hood Incubator. As well as a lot more physicians. I interviewed a neurosurgeon. If you guys haven't heard that podcast episode, please listen to. We interviewed Dr. Ronald Ongding. He's a neurosurgeon out in Sarasota, Florida, who prescribes medical cannabis for, seizures, epilepsy, a range of things. And he's got all these amazing patents, but he was not, at all interested. He said, ask him 10 years ago. He was like, absolutely not. And he's an Asian American doctor. So he's also talking about some of the stigmatism within their community. But where do you see yourself and your business? Will there be a Dr. Jocelyn Doula Association, that the girls can come through and get their doula certification? Where do you see yourself going?
Definitely there is an echo. I definitely see that in the future. Not right now.
Okay.
I'm just starting this venture. I've got my books filling up, and I do see some interest in the birth community, but there is a little bit of apprehension there. I don't see the classes filling up for that course. There's a lot of everything has to be evidence-based, and I spoke to this. I posted on IGTV, and I spoke to this kind of apprehension that I see in the birth community because there is no evidence saying that it's safe. The automatic assumption, again, is that it's unsafe. So a lot of birth professionals, doulas, and midwives alike are still saying, to abstain, and they don't offer supportive services in that way. So I still have to get a lot of information out to the right people before I even think about trying to train people, because they need to drop their stigma. They need to get, they need to get to a place where they're ready and willing and open to new information. But on the cannabis side, the cannabis community is very interested. So what I see happening is seeing more people who are not doulas, who are not birth workers, coming into the fold through this door that I'm opening. That's what I see happening, and I'm really excited for that. I want people who are already in the cannabis community, who understand this life, to then be supporting each other. That's what I see happening.
Oh, I love that. Now, what's next for you? I see that you have a Patreon.
I do.
Shout out to you.
For a while.
So
I've been
tell people
for almost a year. Yeah.
We have one too. So tell people about your Patreon and how they can support your work and where they can find you.
So my Patreon is the CannaDoula. Right now it's going under some changes. I'm changing up some of my rewards. What I really want is for my Patreon to be a source for 1 or 2 families, maybe 3 a year, who need services but cannot fund them. So then the Patreon becomes a crowdsourced support system for them. That's the goal for Patreon. I really I worked on my website for like a year. It's the most simple website. The simplest things take the longest. So I worked on that for a year. It's live, CannaDoula.life. You can find information.
Life.
Yes. Blog posts. There's going to be vlogs on there uploaded fairly regularly. And we're just going to keep getting the information out, keep getting the idea out and theories out. Working with other canna mommies and other influencers on Instagram is one of my big goals, because these women are doing amazing work. You included. You have created communities that otherwise wouldn't exist. And you're showing them the visuals that you were showing they take away so much stigma, because so much stigma is given to us through visuals, through propaganda. Yeah. So to switch that, I'm loving it on Instagram. That's why Facebook is crickets for me for the most part. I try with Facebook, but I'm just like, I've been on that platform for so long that I'm just like, Instagram is where it's at. That's just, everyone is there and everyone is really interested in a new way of learning and a new platform to learn on.
Absolutely. I freaking love that. And just as a marketer, I will just double back on that and say, go where your audience is. Don't believe the hype and you have to be on 20,000 platforms. Go where your audience is and serve them. Give them value. So before we go, oh, wait a minute. Let's see. Patricia got a comment. Let's put this up here. I had a midwife 35 years ago. Doulas were not even referred to in common conversations, but this work was done by midwives working under supervision of physicians in hospitals. So, cannabis was not a co-sideration. Midwives were treated the way Jocelyn described, doulas of color, but they were the only option working in hospitals like Beth Israel, where I gave birth. Wow. 35 years ago? Yeah.
The midwives have so much more time to focus on their job when a doula is there working and doing their job. A doula is up here in the mind, body, and spirit. The midwife is supposed to be doing the actual medical work. And when they can focus on that, you can have amazing results.
And this is
full support spectrum.
So I could be a midwife.
You could be a midwife.
This seems like like a whole nother level of like spiritual kind of, work. But that's just me. I don't know. Somebody else.
A lot of the Black nurses from our history were doulas and midwives as well. They weren't just nurses. We're in a way, we're trying to compartmentalize these roles because we've been bogged down with all these different roles and hats. And so when you start to delegate roles, all these different things pop up. Doulas. The term death doula is really popular right now, and it's really important. We millennials, I'm not thinking about death, and I really need to. And a death doula will get your ducks in a row before it's absolutely necessary, before there's like an event, an accident, a sickness. And that's something that I didn't even think of.
Wow. So, okay, top tips for anyone who wants to embark on this journey this is double, or wants to get a CannaDoula, but maybe they don't live in a state, what would be your tips for them, the pregnant woman? And then what would be your tips for anyone who's inspired to walk the walk that you have done?
So for the pregnant person who lives out of Arizona, I do offer e-doula services.
Work.
Extremely discounted because I am not in person with you. And that's on my website as well. All the different packages. When you are interviewing your birth team, if you feel uncomfortable mentioning cannabis, remember that you will always feel uncomfortable with that. So if you hire them, that will always be something that you might feel uncomfortable with. You might be able to talk to them about it later. but it's something that's going to stick around. When you're interviewing your doula, if you can't speak to your doula about it, I'm not quite sure that's the doula for you. You need to be able to speak to your doula about pretty much everything. You need to be open, and that is your support person. That is your team you. And if you can't go full on hard team you with your doula, that residual fear could stall some things, could make some problems and barriers for you later on. That's why I offer the e-doula services. So even if they have support people in place, there's still that one person who knows their full truth.
Okay. And if I want to embark on the journey and do this work, yes, where should I start?
Google's a good place to go.
I love Google. Love Google.
Find out what kind of doula you want to be. Do you want to be a radical doula? Do you want to be a traditional doula? Do you want to focus on pregnancy, birth, and postpartum, or none of that at all because you ain't had an experience like that? But what your experience is with is mental health, a mental health doula. Doula the world, for sure. But when you're embarking on it and you want to be a CannaDoula, contact me. Okay. You're going to want to know your laws. You're going to want to have some kind of legal protection for yourself. Any kind of liability, gray area, you're not going to want. I don't provide any medication. I don't do any medical services or anything like that. So a lot of my liability is reduced because of that. Okay. But tread lightly, know your rules and stick to them as best you can, and keep going because your work is needed. There's a need and you need to fill it. So keep going.
Well, there you have it. Doula Jocelyn, all the way from Phoenix, Arizona, this lovely first day of July. So happy third quarter, everybody. Thank you so much for your time and for your energy this morning.
Thank you for having me.
I learned so much. I know you guys learned so much. Please, like and share. And if you have any other questions, Doula Joyce is available. Website again is Doula Joyce.
Oh, I'm sorry. I was reading the comments again. Just to make sure, what was your baby's disposition like? Baby like, woke up, wanted some booby. And now they're regular schmegular people, 6 and 3. I don't have any problems with my kids. They're little tiny me's. I've never once thought that cannabis did anything or broke my kids. So don't worry about that. But my website is CannaDoula.life. And if you want to email me, you can email me at talk@CannaDoula.life.
Let's see here. All right. Well, guys, there you have it. Jocelyn, the CannaDoula. Thank you so, so much. Guys, thank you guys so much for your energy, being here with your comments, sharing your experience.
Arizona people, and it is 7:30, so good for you.
Sharing your own experience. This really helps push the movement forward and push this work forward. So thank you all so much for showing up. More to come. Thank you for riding with us through the technical difficulties, child. This morning, what in the world? So thank you. Enjoy your day. Have a great 4th of July. And that's it. We'll talk to you guys later. Thank you.
Bye-bye.
Bye, guys.